When a man hears the word you have prostate cancer and considers surgery as an option, there are many questions. Believe me, I've been there. I know. Will I lose control? Will I lose intimacy? Will I lose myself? Well, tonight we're cutting through the fear and confusion to explain what prostate cancer surgery really looks like today, from robotic procedures to minimally invasive options, and what every man should know before making a decision. So stay with us. This conversation could change how you think about treatment and about hope.
So we have a confirmation with a second opinion that he definitely has prostate cancer.
Welcome to If You Are My Brothers, a podcast created to break the silence around prostate cancer. I'm Reggie Hicks, your host, and Happy New Year, and welcome to our first episode of 2026. Wow, can you believe it? We also want to welcome everyone watching on YouTube, Facebook, LinkedIn Live, and to those listening on your favorite podcast platforms. And before we begin, a quick reminder that this podcast is not a substitute for your medical team. Some conversations may be of an adult nature, so we want you to listen accordingly. And remember, always consult your healthcare provider regarding your personal health decisions. Now, to learn more about this podcast and the If You Are My Brothers documentary and community engagement project, you can visit our website at ifyouaremybrothers.org. In the meantime, we invite you to join the conversation in the chat. You can ask questions, share comments. Definitely share the link to this live broadcast right now to your friends and family and colleagues, because this is real life, but it's also a conversation. Now, our guest today is Dr. Rajesh Laungani. He's a board-certified urologist in Atlanta, Georgia, specializing in adult urology, urologic oncology, minimally invasive surgery, and robotic urology. This brother has a lot going on, I tell you. Now, he serves as director of minimally invasive and robotic urology at Piedmont Hospital in Atlanta. He has over 20 years of clinical experience in treating conditions, including prostate cancer. Dr. Laungani has helped thousands of men navigate probably one of the most difficult decisions of their lives. And he's here to break it all down clearly, honestly, and hopefully without a whole lot of medical jargon. And we want to thank Dr. Laungani. Doc, thank you for coming on, and welcome to If You Are My Brothers.
Reggie, appreciate you having me. Want to first and foremost, again, like I said, thank you for allowing me to join you. I want to congratulate you on your success on the podcast and just make sure you understand how important it is, what you're doing, your mission, the word you're spreading, the education you're giving to our men about prostate cancer and many other things, but just kudos to all your efforts. It's really important to have, soldiers like you on the ground helping us out, helping us kind of carry our mission out, helping educate our guys. We can do our part, but our patients and our community serve even a bigger role.
Thank you for that. And yeah, it is definitely a team effort. And full transparency, just so everybody knows, that Dr. Laungani was my doctor, my surgeon, who performed my prostatectomy some years ago. And I am so happy to have you back on. I've seen you a couple of times, mainly in the gym. You're probably there more than me, but the times our paths have crossed, we got to touch base a little bit, and want to thank you again for being here. So, Doc, let's start at the beginning. I know you come from a family of doctors, so I'm sure you were probably inspired by that. I'm also curious to find out what it's like to grow up in a family of doctors, first of all, and why you decided to specialize in prostate cancer and also get into robotic surgery.
Timing is everything, as they say. You are kind of where you come from. You are what your background molds you into. My father was a urologist, so that may have guided some of my decision making. My initial thoughts were actually orthopedic surgery before urology, but that being said, I kind of fell into the specialty of urology, almost fell in love with it based on the type of pathology I saw, people that I was working with, the personalities of urologists in general seemed to vibe with the person that I am. Surgeries were extremely interesting. I was able to take care of things like cancer, kidney stones, urinary issues. I was able to talk to guys and men, which was really, a lot of times a group of individuals that unfortunately I feel like are a lot of times ignored or don't bring their own health to the forefront. So it was a good population that I wanted to really take care of and treat. And the patient population is great. I feel like I talk to my patients more about how bad the Falcons are than about their pathology. We get along really well, and I know a lot of my patients on a very personal level. So it's just a phenomenal field. But I enjoy taking care of prostate cancer. It's a disease that is always evolving in terms of its treatment, our understanding of how aggressive it can be, what to treat, what not to treat, what to watch, what to radiate, what to operate on, how to manage advanced cancer. These are exciting times in this field. And we're finding a lot of new breakthroughs and allows us to take care of our guys that much better.
Was there a transition? Were you always in the robotic surgery arena, or did you sort of start with this general surgery and then move into that?
Well, the way things worked out was I landed at Henry Ford Hospital in Detroit in 2003. And robotic surgery had just been started at that time. It actually was initially created for cardiac procedures, and that never came to. And then through a very generous endowment by an individual at Henry Ford Hospital, robotic surgery picked up there and prostate cancer surgery started there. So I was actually at the right place at the right time where things started. The first gentleman we operated on was about an 8.5-hour operation. God bless him for signing up. And now we've got it down to about 60 to 90 minutes. So it's a very different time, but I was there. It was something that clicked. It was something that I found interesting, and immediately we were leaders in the field there. So again, timing is everything. Where you land is everything. And it just so happened I was in the right place at the right time.
So you were actually like at the beginning of this whole thing. I didn't know that. That's great.
I've seen this since it was in infancy. I've watched it grow 4-5 generation of robotic systems. Yeah, it's been really an amazing journey to see where this started and now where it is and how it's evolved is essentially the standard of care, and how we were kind of those first residents where tomatoes were being thrown at us at meetings when no one believed our outcomes, no one believed we could do what we were doing. And now everyone's following suit and doing exactly what we knew they would do. So it was great.
Yeah, and we're going to talk about the future too in a few minutes. But as you look at men that come in to your office and, they're kind of, I know we all sort of go through this process of trying to decide on what treatment once we're diagnosed. Just what would you wish men would understand, or before they walk into your office, or there's some misconceptions that you kind of run into when men first get there and they're like, doc, I just want to get this out of me, or they're not sure what to expect?
Yeah, first and foremost, for most men, it's important to be upfront and honest about their own health, about taking care of themselves, about not feeling like their problems will become a burden on their family. Because I know a lot of men don't necessarily, we as men are not necessarily trained either mentally or physically, and it may be a generational thing, where we're to bring our burdens and our problems, whether it's health or financial or work or emotional, we don't bring those to our family because we're trying to manage everyone else's, or at least help with everyone else's. So a lot of times men become stoic and they become quiet about their health problems. And sometimes they're ignorant in the sense that they hope things will just kind of go away or work themselves out without really identifying where do I get help or who should I ask for. Women are the exact opposite. That's where Susan G. Komen originated, right? One woman is diagnosed with breast cancer. She calls her sister, who calls her friend, who calls her aunt, who calls the mother, who calls the girl. And all of a sudden you've got this entire chain and support system. Whereas if an individual or a man is diagnosed with prostate cancer, he may bring it up to a buddy of his in the locker room if he happens to hear in passing that someone else had it, So first and foremost, they have to be upfront and say, what, I got something, I need to take care of it. So let me be upfront and honest and be proactive. Secondly, when they do come into the office with a diagnosis, they have to understand that not all cancers are created equal. So the C word, or cancer, does not always mean a death sentence. It doesn't always mean I have to get my affairs in order. It doesn't always mean, oh my God, am I going to be around for my daughter's wedding or see my grandkids graduate? So it's important to be informed. Try your best not to let your mind kind of lead you into what you see or read or Google or what's on Instagram or TikTok or Facebook. The internet is good on some level for information, but unfortunately nowadays it's hard to tell the difference between information and misinformation.
Yeah, and AI is just, and then there's also, and I talk about this all the time about, clickbait and how people have thumbnails that are just crazy. I've found the cure for prostate cancer and check this out, just to get people to click on it. Do you feel that And hopefully doing this and others that kind of work to get the real information out, will kind of help to supersede some of this stuff that's happening out there. Do you feel that men are, because I know when you talk about the surgical options, and what are there, first of all, because I also want to talk about men who may not be quite honest about their medical conditions. Let's talk about that first. Do you feel that men, I know you probably have the chart, but are they reluctant to really fess up and say, doc, I smoke, I drink, are they honest about that?
Yeah, I mean, again, it goes back to kind of minimization of their own issues, whether it's chronic high blood pressure, poorly controlled diabetes, weight, history of prior surgeries. I mean, these are all things that can increase risks of complications associated with any treatment, particularly surgery. So when we see gentlemen who come in for an operative consult, we love to operate, we love to take care of people. And I tell patients that, but you'd be surprised how many people we choose to operate on versus not, based on we want a good outcome. We want the individual to have a good outcome. So just because you're a hammer doesn't mean everything's a nail. So you have to be cautious. You have to be somewhat confident, but at the same token, understand that just because you have cancer, it doesn't mean that your prostate needs to come out. In many cases, we can watch it. And in many cases, based on age, comorbidities, life expectancy, type of pathology we find, we'll steer men towards radiation, if we feel that they're a better candidate that way. So some men actually leave our office a little disappointed because they come in and say, hey, my plan was to have the prostate out. But we do our best to educate them and let them understand the true pathology behind their disease and say, okay, you know what? You're better off having it removed, or you're better off having it radiated, or you know what? You're better off not having to do anything because something else is going to get you before cancer ever will. Those are sometimes tough conversations to have, but we have to make sure our guys are well aware of what the options are.
That's comforting to know, coming from a surgeon as well as a urologist. You come in thinking of one thing and, giving them all the options. And speaking of options, so what are the main surgical options for treating prostate cancer today?
Yeah, I mean, nowadays, open surgeries, the traditional surgery, which is kind of open surgery where you've got larger incisions. So those were done historically up until probably the mid 2000s, maybe 2006, 2007, 2008. Robotics really took off in the early part, again, the mid 2000s, maybe around 2008, 2009, where it was establishing itself as the standard of care. And that's what we consider minimally invasive surgery. Nowadays, it's rare to find anyone who will have open surgery for prostate cancer. So the standard of care when it comes to prostate cancer is prostatectomy, removal of the entire prostate. Prostate cancer is typically a multifocal disease, which means the individual has a biopsy. That's kind of a small picture of what may be going on through the entire gland. It's like looking at a Picasso through a keyhole. You can't appreciate everything at once. You see little bits at a time, but the only way to appreciate the entire painting is you open the door, right? And then you can see the whole thing at once. So we can do that when we remove the prostate. We look at the entire prostate as a whole, but the biopsy is only a little peek or a little preview. So we have to assume that it is likely in other places. What's coming to more, I don't want to say use the word fashion, but what's now becoming more popular is individualized or narrowed treatment, meaning based on a biopsy, you can have treatment to specific locations of the prostate. So it is specific treatment, which helps to reduce the morbidity and the mortality associated with other treatments. Now, again, it's not considered an absolute standard of care. There's good data surrounding it, but there's so many factors that come into play when it comes to saying, well, what makes a treatment option really efficacious? What makes it work well? How do we know the outcomes are good? It's based on maybe the pathology. If an individual is treating only low-grade cancer with a specific treatment and he has amazing outcomes, well, is it the treatment or is it the fact that he's only treating low-grade cancer that gives him the great outcomes? If an individual is treating really, really high-grade cancer and his outcomes aren't great, well, is it the treatment or is it because he's naturally treating really aggressive disease that is difficult to manage, or difficult to treat, or difficult to eradicate? So there's so many factors that come into play, but the mainstay is prostatectomy for removal of the prostate and treatment of prostate cancer. But there are a whole host of other smaller kind of targeted surgical treatments that are coming to light and are becoming much, much more popular.
Is that where the term minimally invasive comes from, or what does that mean?
Yeah, minimally invasive, it's not a big cut. It's particularly for robotics, it's 4 or 5 little small poke hole incisions about the diameter of your pinky nail. And that essentially reduces the morbidity significantly. And what I mean by that is that the average blood loss for an open prostatectomy is anywhere between 500 to 800 cc's. Okay. The average blood loss for a robotic surgery is anywhere between 25 to 75 cc's. So that blood loss significantly reduces, or lack of blood loss significantly reduces morbidity. Same thing with incisional pain. If an individual can get up and walk the same day of surgery, as opposed to being in bed for 2 days because of muscle pain, that makes a huge difference in terms of passing gas, getting out of the hospital sooner. An overnight hospital stay. In some cases, we've even done same-day prostatectomies where we did the surgery and the gentleman went home the same day. So this dramatically improves kind of the field of how an individual recovers, how quickly they get back to work, their family, their life. So the morbidity associated with open versus robotic is dramatically different. We've seen that through and through. And there's some things that are not tangibly able to be measured. I mean, we can measure blood loss, we can measure pain control, hospital stay. But again, you can't measure how quickly you get back to go to work, or how quickly you get to back on the golf course, or how quickly you can go back and take that cruise you wanted to take, but had to be stopped because of prostate cancer, or how quickly you can spend time with your family. These are things that you can't measure, but are worth volumes in terms of reduction in morbidity and patient outcomes and satisfaction.
Yeah, I remember leaving the hospital the next day, I believe. So I had I had an overnight stay, and when I first got there, I was like, "Oh, I think I'm gonna be here for a minute," and then the next thing I know, I'm up. Actually, the same day, I think I walked around with the drip and walked around, and IV pole, and then next day I was up and ready to go. What does that look like? I mean, I remember being in the surgical room before my surgery, and I got to have a unique tour, if you will, of, I think it was, is it Da Vinci, the whole setup, and to look through and be able to turn things. And what's that like? I mean, because I know I've heard didn't you tweet an actual surgery live?
Yeah, I mean, at one point when before Twitter was X, before Musk took over the platform, and when it was kind of in its early stages, we tweeted kind of live robotic surgery, which was an interesting. I mean, I wasn't physically tweeting while operating. We had someone in the background kind of describing the surgery as we were doing it, but that was one way to kind of bring people into the operating room as live as we could. Because a lot of times we can't do live transmissions based on patient privacy rules, HIPAA violations, So the tweeting about what we're doing, the actions, the steps we're taking was amazing. But, in the operating room in general, I think Da Vinci is still what is associated with robotic surgery. Intuitive Surgical is the company itself. But there are a lot of different companies now that are starting to adopt the technology. They're coming out with different versions, and that's a good thing because, competition to a certain extent breeds excellence, right? So that's what we want. For the past 20 years, it's only kind of been one company driving it. And their innovations have been amazing. And sitting on the newest Da Vinci 5, I think you probably had your surgery on the second generation. Now we're on the fifth generation. And if I can make kind of the Tony Stark analogy, when you sit in the console, it's almost like that. You've got a lot of information coming at you at once in terms of what instruments coming in at what angle, and what your insufflation gas pressure is at, and what the temperature is at, and what the monopolar heat cautery is set at. I mean, these are amazing things. I mean, again, these are all things that are used to spinning through my head on a regular basis. So it sounds like it's a lot, but at the same token, these are things that I'm normally used to thinking about. But now it's kind of visually in front of me, and literally I'm almost able to control it with just a few clicks of my hand. So the technology and the interface it truly is amazing. And it's evolved significantly since when it was born in 2001, 2002, 2003.
So I have to ask you, you're looking through a camera, you're seeing things and you're moving things. Are you pretty good at video games? Because it would seem to me that's kind of...
I mean, I was the generation where, man, I guess I was a generation when Nintendo did come out, just like all of us, my mom used to yell at me for playing too many video games. I will tell you, I cannot compete with my son nowadays on PlayStation 5. So, but I was of the generation where I did have good hand-eye control based on having a controller in my hand. But, the residents coming out today, strangely enough, are better trained on robotic surgery than they are open. Trying to figure out whether that's to their detriment. I was lucky enough that I was right, again, in a sweet spot where I had great open surgery experience and great robotic surgery experience. So I was able to be facile in both, because sometimes you need to do open surgery and sometimes you need to do robotic surgery. So that's sometimes the challenge in training nowadays, because everything is steering towards or gearing towards minimally invasive surgery because it's better for the patients. But then that ability to use your hands, make a large incision, do complex open cases, we're seeing, a change in that in terms of the skill set coming out of residency nowadays as compared to what it was when I came out, some years ago. But we adapt as we can and we go from there. But on average, 90% of the operations we do are with robotics, even on patients who've had prior abdominal surgery.
So if someone's watching or listening to this and they're considering a prostatectomy and maybe going the robotic route, what can they expect from the surgery and incontinence and, what can they expect? I can tell you what I expect encounter.
Exactly. I mean, Reggie, you can keep me honest, and I tell my guys what I talk to them in the office about and what they can learn from other patients is two very different versions. You'll hear from a patient, when the catheter comes out and they're dealing with some incontinence, they may get to a point where they're very, very low. They may be even a little depressed, a little upset. They're questioning their decision. Was it the right thing down my prostate out? I'm leaking urine. That Laungani guy, he told me everything was going to be fine. And, I'm wearing a pad and what's going on. And so, yeah, I mean, those are real emotions that guys will feel. When they come into the office, the picture we paint is that the way they walk in is the way we want them to walk in after surgery. We do tell them there's going to be changes in continence. And for a period of about 4 to 6 weeks, do expect some urinary leakage. But by about 6 weeks, we tell them that that leakage will likely get close to resolving, if not resolving altogether. And factors that can affect that are age. As you get older, you naturally take longer to heal. That's the nature of, getting older. Weight, if you're obese, it may take longer also for that pelvic floor to really strengthen up. Comorbidities like diabetes or any sort of muscular type of comorbidities may affect how quickly you heal. But in general, we see good results at about 6 weeks. And that's different for different surgeons, I will tell you that, because sometimes we see patients in second opinion and they come from a surgeon that said, oh my God, it'll take 3 to 6 months to get your control back. And maybe, but in general, like anything, the more you do a particular thing, the more facile you become at it. And we feel that with our experience, that has allowed us to provide our patients with better outcomes in that regard. So on average, we tell our guys about 6 weeks. Sexual function is another big one. That's also kind of a touchy subject with a lot of guys because, guys want to be active and guys are ready to be active until the day they die, I will tell you. But I also examine a lot of guys who come in with their wives, and relationships as men and women get older are different. Libidos change. The ability to be active changes. The drive that a spouse has is different than what the male spouse may have. Achieving erections, a return of sexual function, yes, for a period of several weeks and not even for a few months, things are not going to work as expected. But it takes two to tango. It takes some rehab therapy. It takes use of medications that are available nowadays like Viagra and Cialis to get blood flow going. So again, I try my best to be upfront and honest with my guys about timeline. I'm not trying to paint a dreary picture of how recovery is going to be. I try to do my best to be optimistic about their outcomes. And again, the majority of guys do extremely well. But I also tell them that with anything, surgery is surgery, and outcomes can sometimes go the other way despite our best efforts and despite having the perfect surgery. And it's happened to me before. It's happened to any of my colleagues before. But that's like anything you do in life. You do things knowing within the vast majority of times, everything will work out. The example I give my guys all the time is getting in your car and driving to work. You wear your seatbelt, you obey the speed limit, you're a good driver, and sometimes despite all those efforts, bad stuff can happen. So we look at it the same way. Outcomes will likely be just fine. So again, potency, sexual function. And then for my guys, getting out of the hospital, getting back to family, getting back to work, really important aspects of quality of life that are important to me. And then finally, the last one is cancer control, which, obviously you can consider the most important. Right. You want your PSA to be 0 after surgery, which is strongly indicative of we've got the cancer, it's out, it's no longer present in the body. So we hit that trifecta: cancer control, urinary control, and sexual function. That we know we've done a good job.
Yeah. And, I tell men all the time that everybody's different. I mean, you could talk to someone that's had a prostatectomy and they're like, oh, I'm back to normal and everything's fine. And then some say, well, ED was a part of it. I didn't have it before, like myself. I didn't have it, but it became an issue after. But to your point, there are different things you can do. And also working with, your significant other, or, it's a thing you can get through. But I think what you said at the end is the most important part is the cancer gone and what happens after that. And I think that is a lot of times men don't see that because they're thinking like tomorrow and the next day. I know it took me maybe about, like you said, about 6 weeks to sort of get back to normal. When I said get back to normal, as far as walking around and being comfortable, and the catheter was for about a week. So that was, that was interesting, but it's all about healing. So I think that, to your point, and it's hard for you as a surgeon and as a doctor, how hard is it really to have men understand that everybody's different, things are different, you want the best outcome, but how do you kind of get around that when they come back and say, well, you told me that this might happen and it didn't happen? Or how do you navigate that?
Yeah, I mean, I do my best to be upfront and honest with everyone about outcomes. If they do come back and things aren't exactly the way they expected, I do try to kind of walk them back off the ledge a little bit, reassure them that everyone's timeline is a little bit different. I try to evaluate, hey, are there things you're doing at home that aren't quite what we recommend? Or, we've had guys go back to work day one. We had one guy, ride a Harley a week after his catheter came out, and he came back complaining about why he was incontinent. I said, well, you can't get back on a motorcycle. I now have a list of things that I tell men not to do as I learn more and more what men are doing when they shouldn't be. But it's not all, always about them. I also try to tell them that, everybody's individual heals differently. Challenges on a day-to-day basis are different for each individual person. Some people have to get back to work. They need a paycheck. They need to put food on the table. They climb ladders for a living, or they're in a delivery truck for a living. So I can't live in a bubble saying, well, you got to sit home for 6 weeks and heal, put your quality life or your work life at risk. But it is difficult to navigate when, at the end of the day, you want what's best for your patient. You want the best outcome. We do feel good when a guy comes in and goes, Doc, I'm so happy. This worked out so well. Exactly like you said, I'm dry at 4 weeks and I'm noticing signs of life with sexual function. That's a sense of pride, And then you do feel nervous and you do feel anxious naturally when you see patients who chronically aren't doing as well as you'd like them to do. And you're going to see them again and you're going to address probably the same issue. They're not satisfied, and you hate to ever have a patient second guess their decision to have their care with you. And that's a tough feeling to have, but we also accept in medicine and in surgery, whether it's urology or anything, that this is what comes with the job. We do our level best to take care of guys the best way we know. We go back to a skill set that is ingrained in us at this point. We can almost do in our sleep on some level to manage guys the way we know how to manage them. And like I said, the majority of guys come out doing great. Timeline is always a little different, but at the end of the day, you reassure them, you build confidence in them, you make sure they understand that this is just part of the journey. It's always a marathon. It's never a sprint. Line is at different places for different people. As long as they kind of understand that, it's important. Then spousal support, that's huge. If they feel pressure from their spouse to perform, if they go, my wife is pissed off at me because my erections aren't as good as they used to be. Well, that doesn't help. But if you've got a supportive spouse who understands what they're going through mentally, what they're going through physically, understands that sometimes you're going to be in a deep, dark place based on your diagnosis and your recovery, but you'll come out of that. I've seen that 100% of the time result in excellent recovery. When your woman is standing by your side, partner is standing by your side, whatever the case is, that makes a huge difference. It's almost like you recover with no pressure. You take your time, you do what you need to do. We're always here. We're always ready. That's a big one.
Yeah. And I think to that end, I've been really blessed because my wife, she came up with this saying she always says is life over libido. And from the very beginning, she understood that. And I guess too, part of being involved in the documentary and, my fraternity's brother's story, who had a very aggressive form of prostate cancer, and he lived for 6 years after being diagnosed with a PSA of 100. But she understood that it is cancer. It can kill you. And if not treated, and if you catch it early, it can be around. Like I'll be celebrating my birthday tomorrow. So it's another year, another trip around the sun that is a blessing that others may not have as a result of maybe not dealing with this soon enough or whatever the case. And that's what we try to tell men, that there's no panacea. There's nothing that is going to be 100%. Now, some men may experience that, which is wonderful, but understand what the bottom line is. And that's to get the cancer, to become cancer free, or, and move on with your life. So how many of these have you done? Do you keep count, or do you kind of like know the ballpark? So,
Yeah, I mean, we're looking at probably going back to '03, year 23 of this, so 3,000 plus. We've been doing this for a while. And like I said, we've seen this since its infancy, since the first operation done in Detroit. We traveled the world doing the operation. We shared our experience with people all over the United States and all over the planet. But yeah, we're probably looking at 3,000 plus, 3,500 plus at this point, which is great. At some point, we've seen a lot of variations, a lot of different anatomies, shapes, sizes, colors. So it prepares us. It's like we've driven down the road multiple times. We've seen all the different potholes that you can see. Again, you do something long enough, you see enough variations of it, and that lends into or builds your experience. So that's an important aspect when guys go and talk to physicians, urologists, surgeons. It's important to kind of understand, well, how experienced are you? How many have you done? Because there's enough data to suggest that obviously the more you do, the better you are at it. The more jump shots you take, the better shooter you're going to be. Now, again, all that being said, you got to start somewhere. So, and what I mean by that is that the first guy I saw in 2009 when I started practice in Atlanta, he had to have enough faith in my pedigree and my background and my skill set that I was not 3,500 cases deep at that time. But he must have said, okay, this kid knows what he's doing, and I think I'll stick with him. So it's a tough place to navigate, because for the newer surgeons who are starting out, if they don't have the case volume, then you kind of want to explore maybe if you like your surgeon, you like your urologist, but you're like, well, he hasn't done a lot. But look at his pedigree. Look where he trained. Did he come from a center that's high volume? Because I came out of a fellowship that was extremely high volume. We were doing 1,200 to 1,500 prostatectomy cases a year. So I came out boots on the ground without even stopping, but not everyone has that same experience. So even if your surgeon has not done 3,000 plus cases, but he's trained at one of the top centers in the country, yeah, I'm pretty sure he's got the skill set that he can use to take care of you. But yeah, in general, you want to try to lean towards a guy or a surgeon, female or male, that has a larger experience, because that lends to, again, potentially better outcomes and the ability to kind of navigate more difficult situations or cases. Where we are now in Atlanta, we become a bit of a referral center for some of the more challenging cases that gentlemen in the community don't necessarily want to take on, whether it's prior surgery, body mass indexes that are very high, very large prostates, aggressive cancers. So they know that with our volume and our experience, we can handle this. Again, it's an important question to ask. How many have you done? Where did you train? Those are simple questions, and don't be afraid to ask them. Don't ever be afraid to question your surgeon's experience. It's like going to a mechanic. It's like you want to know who you're dealing with. And if he's operating on you, that's an upfront and honest question. And if that surgeon gets insulted because you're questioning his abilities, then, he may not be the guy for you. But, you got one body. You have to be careful who you allow to touch it. And you just say, hey, listen, man, how many have you done? Where did you train? I just want some information on your background before you put a knife to my belly. And that's important.
Are there other questions, just as we close out? If someone's watching this and listening to this right now, what else should they think about when they've decided, well, I'm going to go this route, and they're a good candidate for this?
Of course. I mean, just find out obviously what technology is being used. When you say robotic surgery, confirm, what is the technology that's being used? Because there's a lot of different terms for, robotics. Do your best to do your research before you come in terms of, there's a lot of literature out there. And again, there's a fine line between being informed and confused. And a lot of guys tip that line and they come in over-informed, and they're kind of so much information and so many options, they get overwhelmed. But yeah, ask about your surgeon, about his pedigree, about his volume and his experience, about what the technologies that he's using. Does he have a team that he uses on a regular basis? Does he do all his operations in one hospital? What kind of support system does he have in terms of mid-level providers like nurses or PAs? Do they have other patients that individual can contact? I mean, I give my number, Reg, you're on the list, but there are probably 20 or 30 guys where I could easily give their number out and say, hey, call this individual, and he'll tell you the truth. He'll tell you the skinny of his experience with us. And if you like it, then come on back and we'll take care of you. But they'll give you the complete upfront, transparent truth. And I have a list of guys that I know I can count on that are going to be upfront and honest and are advocates for prostate cancer. So those are important things to ask. And again, don't ever be afraid of insulting your surgeon. It's important that you have a good relationship with them, because if they're going to take care of you, you're going to be with them for life. Checking your PSAs, monitoring your health. I mean, all that stuff. So this is the first step in a long relationship.
Wonderful, wonderful. So as we close out, I know you have done some work over at Clark Atlanta at CCRTD and the whole future of prostate cancer and those kinds of things. What gives you the most hope when you look at where prostate cancer, and particularly prostate cancer surgery, is today? And what does the future look like?
Yeah, I mean, the future, I'll tell you, I mean, surgery. And the good news about my field is that AI won't ever take it over. Hopefully not, right? Everyone's always worried about that. And hopefully AI is not coming to the operating room anytime soon. AI is very algorithmic, but nothing can replace a human hand and a human brain. Not yet. So hopefully in real time, exactly, that arena will stay safe. But the advances we're seeing for prostate cancer are really in the forefront of advanced disease. You know, when patients present with recurrent disease, when patients present with metastatic disease. And unfortunately, we still see a lot of guys showing up to our office with PSAs of 300, 500. They haven't seen their doctor in 10 years. They were nervous about seeing their physician. They've never gotten a PSA before. And unfortunately, Reggie, I'll tell you, we see that a lot in the African-American community, you know, and I don't know, it's sometimes hard to pinpoint nowadays with the amount of information overload we get through our phones and through the internet, why people or patients are not more proactive about taking care of their own health. But that being said, advances in advanced disease are significantly better than they were 5 or 10 years ago. So we are keeping men alive without having to jump into chemotherapy right away. We have multiple layers of hormonal therapy treatments that are now available, maintaining reasonable quality of life. I can't tell you that taking hormone therapy is going to make you feel like a superstar, but I can tell you that it's a hell of a lot better than taking chemotherapy. Advances in that arena have really changed the game in terms of how we can manage guys, even when they're diagnosed with metastatic disease or recurrent disease, where with other cancers, you know, they've got a very short timeline. But even in the face of recurrent and advanced prostate cancer, you can live 10, 12, 15 years if it's managed well, if it's followed appropriately, if the right medications are used at the right time. So that's a big one. But I'm excited to see where surgical outcomes develop, how things develop. I'm hoping, you know, specific prostate cancer treatments for targeted areas will develop into something bigger to help our guys or save our guys from continence issues and potency issues. You know, and we're learning more about cancer itself, which cancers to treat, which not to treat. That's a big one too. Not all cancers are created equal. So just because you've been diagnosed, you know, really be informed about how bad is it, how bad isn't it, put it that way. But again, get the right information from your doc and, you know, he'll be there to help you make that decision.
Now, you mentioned that, I guess when I had my surgery, I was, the Da Vinci was like 2.0. And so now you're like at 5. What's changed in that? I mean, what's changed in just the whole system that you're seeing now?
Yeah, well, it's mainly the interface. I always give the company examples of the difference between the iPhone 3 and the iPhone 17. You still have to tap on the screen to type your text message, or you still have to pick up the phone to talk. So the basic principles behind what a phone is and what a kind of interactive phone are the same. And that's the same thing with the robot. But the difference is the keypad style, how the apps are set up, the processing chip, how the information is presented, how easy it is to go from one screen to the other. You know, those types of things that allow the phone to flow better, allow information to be transferred easier, allow communications to be smoother in different ways. Giving a thumbs up emoji as opposed to saying that's great. I mean, that's just a different way of communicating, but at the end of the day, you're communicating the same thing, right? So similarly to the robot, it's all about now the interface and the experience, even the ergonomics of how I sit in the Da Vinci 5 versus how I sat in the Da Vinci 2.0 are game changers for my upper back, my lower back, my neck. I mean, I used to come off tight after an operation, you know, and now the ergonomics have changed such that it literally molds and moves with me, which is unbelievable. So little nuanced things change, but at the end of the day, and the company hates when I say this, I always say, I go, you know what, if you give me a first generation and you give me a fifth generation, I was like, I can do the same operation on both. I was like, yes, one is smooth and one is sexy, but I can do the same operation on both. And they always say, like, we don't need you to go around and announce that. I go, I know you don't. But it's about the surgeon. It's about the experience. It's about, you know, knowing the anatomy. It's not about the car you drive. It's about how good of a driver you are. You know what I mean?
Yeah, we learned that in Formula One. So,
Exactly. So, but yeah, those are the big differences.
is there anything else that you'd like to leave us with before we let you get some rest? Because I know you did surgery today. And
Yeah, I mean, my biggest thing, right? Like today, we did 2 gentlemen with prostate cancer. We also did robotic surgery for kidney disease as well today. So we had a busy day. But my biggest thing is what you're doing. Okay, spreading the word, educating our guys. That is the biggest thing. Education for our men, telling our guys to be upfront and honest with themselves. Forming a band of brothers when you've got a problem, when you've got an issue. Don't be shy. Talk to your doc, talk to your brother, talk to your father, talk to your buddy in the gym, whatever the case is. We've got friends that are actually a patient of mine is a high level up in the Falcons, the Atlanta Falcons. And when he invites us to games, and we go to games and we see the pink cleats and we see the pink towels and we see pink armbands. And I always tell him, I go, hey, you know what? I don't understand why 85% of your viewing population at the Mercedes-Benz are male between the ages of 35 and 75. And that also happens to be the most common time we will diagnose prostate cancer. And I say, and I don't see a blue ribbon. I don't see a blue headband. I don't see blue cleats. I don't see blue towels. I was like, you are missing education to about 60,000 people on a weekly basis. You got your demographic right here. And I've said that to him constantly to the point where, and it's public knowledge, even our owner, was diagnosed with prostate cancer, Arthur Blank. So and there's a lot of famous people that have done it, but you'd be surprised how that still stays really quiet. Our ex-president, Joe Biden, that came to light after he's dealing with it now, but that was kept under wraps, granted for potentially multiple reasons, but it's still not brought to a head the same way breast cancer and some of the other cancers are how we are all educated. But I think it's about guys. It's about kind of not coming forward and not being open and upfront and not wanting to show vulnerability. And that's an unfortunate nature. That's good in one sense, that we're tough and we kind of push through and we do what we got to do despite what hurts us. But at the end of the day, that might be doing more harm than good. But guys like you are doing exactly what we need, just wearing that hat. And I'll tell you, I have a gentleman put a tattoo of a blue ribbon on his hand here, and it was on the hand that he shakes with. And I asked him, I go, why'd you put the tattoo there as opposed to like on your arm or your chest? He goes, because every time I shake hands, I want to start the conversation, because they'll see that when they shake his hand. Again, it's just about education. It's about making guys aware, tell them not to be scared, be proactive about your health, about your brother's health, about your father's health. And that's half the battle. And then you're helping us, we're on the same team. So those are great efforts. And we always appreciate everything you guys do. So I want to thank you again for putting this podcast together, spreading the word and allowing me to do my job. So I appreciate that.
All right, Doc. Thank you so much. We're gonna have you back on. Maybe we can talk about. Well, we're not gonna talk about the Falcons. I see they're getting new leadership here. I don't know. I think we have a better chance of convincing men to do the right thing when it comes to the prostate cancer. And we always say here to turn health awareness into health action. So that's what we're trying to do by having these conversations. So appreciate you. Let's stay in touch. And thanks again. And get some rest, because I know you got a busy day probably tomorrow and the next day. So appreciate you.
You got it. Thanks a lot, Reggie. I appreciate all your time.
Well, I want to thank Dr. Laungani for not just explaining the science and everything behind what he does, but also he understands the man behind the diagnosis. And that's so, so important. And if this conversation has helped you, we want you to definitely share it with a brother, a father, a son, a friend, uncle, a significant other. And you can also visit our website, ifyouaremybrothers.org, to learn more about our documentary, our podcast series, and our community engagement work. Now, If You Are My Brothers is a nonprofit 501c3 project of Straight Street Media. And again, as I mentioned to Dr. Laungani, we're dedicated to turning prostate cancer awareness into health action. We also will have ways to support us in our show notes as well. So when you make a contribution, you'll receive your very own If You Are My Brothers mug. So you'll also be entered into a drawing, by the way, to win an original painting of our logo by renowned artist Cecil Bernard. And the drawing has been extended. So the drawing will happen February 2nd, I believe. So you still have an opportunity to be a part of that as well. Past episodes are also archived on our YouTube channel as well. And we want to thank our producer, Daniel, or we call him Danny around here, Garcia Pozo, and also Zach Reynolds at Borkhouse Productions for providing our opening. We thank him for that. And remember, this podcast, again, is not a replacement for medical advice. Always talk to your healthcare provider. So once more, I want to wish you a healthy, and prosperous new year. And tune in for our next episode on Thursday, January 22nd, 7 p.m. And we're going to be featuring a roundtable with men sharing their experiences with prostate cancer, talking about their journey. And hopefully you'll join us and be a part of the discussion. So until then, if you are my brothers, remember to share this message. So take care, stay healthy, peace.